Welcome back. Thank you for staying with the news desk. Let's continue with the broadcast. Now, Health Cabinet Secretary Cicely Kariuki has hailed the progress made by the National Hospital Insurance Fund in providing cover for Kenyans both in the formal and informal sectors as Kenya makes steps towards the universal healthcare coverage. The Cabinet Secretary was speaking this morning on the NHIF reforms.
Today, NHIF covers a bulk of people in the formal sector. You and I, public employees, employees in the private sector. That is the primary mandate of NHIF, and it is mandatory for you and I, if you are in the formal sector, to pay up to NHIF, so that then in return, the premium that you pay can earn you healthcare services. But over time, NHIF moved forward and solicited, through some aggressive promotion, contribution of premiums from the informal sector. Fast forward after devolution a few years ago, again NHIF moved forward and got into negotiations with the county governments, for example, who also contributed premiums on behalf of some of the people living in this county, but also their employees. And we went on an aggressive drive up to now, where we have 74 different schemes. 74. Best practice, as is documented in this report by the expert, says that we need to have no more than between 1 and 3 schemes. Here we have 74, and you can begin to see now the issues of inefficiencies, particularly from an administrative point, because you have to service each one of these sets.
We're talking about an all-encompassing insurance that covers all Kenyans. And therefore, the best regulator for that is actually Kenyan. So the regulatory framework we've created, when NHIF stops offering private insurance and commercial insurance and sticks to these 3 schemes that we have proposed, or eventually when it's consolidated into one, is that, number one, we have enhanced the role of the ministry in terms of regulating NHIF, in terms of what report NHIF does. Today, NHIF only sends a financial report. We have added operational report that goes to the ministry. Obviously, the government audit systems will also audit NHIF. Over and above that, then, we have created a national stakeholder committee, which brings all the interested stakeholders, health professionals, that's doctors, nurses, and all the rest.